Welcome, it's Steve Light from Leading Light TV, and I've got my special guest today with me, Jonathan Berendt. And Jonathan has been helping people overcome social anxiety and related issues for over 30 years. Isn't that right, Jonathan?
Actually, it's 34, 35 years at this point.
Oh, 35 years now. Okay.
We all age.
Yeah, and you've written a few books as well. And yeah, the reason I wanted to speak to you really was because, you know, I've had these issues myself, and I want to create these videos to, you know, create more awareness first of all, because it's still relatively a new disorder, and you know, you've had a lot of experience in this field, and I just wanted to start off asking you, you know, as you've been helping people for over 35 years, what made you get into this area of social anxiety?
Actually, it was by fate. In 1976, right out of graduate school, I was working as a youth worker in a community center, and one of my professional associates had an idea. She said, let's start a socialization program for teenagers with learning disabilities. And I had actually no idea what she was talking about, but I did research and I found out that there was no such program. So we started out doing interviews with the parent and the teenager. And then a very interesting thing happened. The high majority of the people would not show up at the group. That's how, in 1976, before the term was popular, I discovered social anxiety. And by the way, certainly at the beginning of my practice, with this discovery, there was a very interesting correlation that I made with learning disabilities and their relationship to social anxiety. A learning disability is a hidden handicap. It causes internal confusion, causes anxiety, hence the need to avoid. The more a person avoids, the more of a deficit with social skills there are, and hence self-esteem issues.
Yeah. Yeah, okay. Yeah, that makes a lot of sense, and you know, that is one of the main problems with this issue, because I run a support group myself, and it's very common that people may have tried to come along for a couple of years at least, just, you know, imagining what's going to happen at the group. Will they feel nervous? Will they be made to speak? It's such a difficult thing to overcome sometimes, and I found that, you know, with myself, it took me 2 years to get to a support group, and once I did, I wondered what I was actually worrying about. But it's just that initial step, isn't it?
Well, it's pretty. What I've seen since 1976 and working with about 10,000 people with all ages, I think I've seen just about everything.
Yeah.
It would be unlikely that somebody with social anxiety tells me anything that I haven't heard. And the reality is that there are so many different variations of social anxiety. On one end, we have the executives who come to me because of fear of public speaking in a formal sense, or probably the most common thing in the world right now with social anxiety is talking in public, not just in a formal sense. Conversation anxiety, and as that relates to a condition called selective mutism, which is fairly prevalent, but there are not that many people who know how to treat it worldwide. We can get into it if you like. On the other end of the spectrum are individuals who have pervasive social handicaps or anxiety. And again, there are many different manifestations of this problem, but there are two basic types of people who have the problem. And this is something that I have found the mental health community just in general does not understand. One is the individual who has initiative. That doesn't mean ability, but initiative means the motivation to start up. All other individuals do not have initiative. For example, no children have initiative. Most adolescents do not. The 26-year-old who's up in his room playing computer games, video games for 50, 60 hours a week at the expense of socialization does not have any initiative. And what the therapy community does not get is when you have these individuals who do not have initiative, you need to involve the caregivers or the enablers in order to have effective treatment. Because one of the ways that I look at social anxiety is It's an addiction to avoidance. Avoidance will tell you a lot about the degree of the problem.
Wow, I like the way you described that, addiction to avoidance, because I can relate to that. It just feels really good. It did feel really good for me to avoid certain things, and there was definitely a pleasure there of hiding away and a little bit of feeling sorry for myself. So that's really fantastic.
Yeah, but correct me if I'm wrong. In the moment when you were avoiding, there was the sense of relief. But one of the things that I have discovered is that, and this is the core kind of work that is needed with individuals with social anxiety, while relief happens in present tense, the more that a person avoids what he or she should not be avoiding, at a deeper level, it becomes an investment in anger, rage, and self-loathing at different levels of consciousness. We have conscious, mid-conscious, and unconscious. And it's that deep level of anger that recycles. When it recycles, it drives the obsessive worry, it drives the anxiety. It's a good investment in dysthymia or depression. And it's these issues that need to be brought to a conscious level to have effective treatment.
Yeah. So going along the side what you've just been saying, as you treated so many people, what kind of common themes have you found when you've treated people? Because you said you've heard many different examples of social anxiety. What is the one core, if there is one, common theme that you've found?
Well, there's many common themes. The most important ones that come to mind are the people with social anxiety are hypervigilant, meaning that their internal radar is overreactive, looking for a perceived threat. And part of this can come from the genetic issue of autonomic hypersensitivity, but most of it is because of traumas being relative, scenarios that have deep imprints in one's mind where there was acute levels of embarrassment, shame, humiliation. These stay deep in the brain. And so the person learns to become hypervigilant for a perceived threat, usually in scenarios where they give people the power to pass judgment. The other very common thing is, and this is again at a core level, is that people with social anxiety, which obviously is based on performance dynamics, people mistake or get confused with performance versus identity. Here's a quick story. Obviously in therapy everything is confidential, but certain people have given me permission to use their name, and one is Kirk Reeder, who used to pitch for the San Francisco Giants baseball team. He won the most games as a left-hander. I worked with them via telephone to help their child with selective mutism, and she got all better. And I was joking around with Kirk, and I said, "Kirk, do you ever have a bad game?" And he said, I was pitching against the Colorado Rockies. I was losing 6-0 in the first inning, no outs, on TV. I said, "How do you deal with this kind of thing?" He says, "Well, I have to pitch every 5th day. So what I think about is, what do I have to do to be better the next time out?" Now, when you think about it, that's the perfect winning psychology. And that's, symptomatic of really good self-esteem. So you have to ask, what gets in the way of a person thinking like that? The answer is too excessive and internal critical script, which is a mind state, and that's part of the work that we do, mind states. And the other is self-esteem issues that get in the way.
Yeah, what you were saying before about the traumatic experiences relating to being hypervigilant. I remember my earliest memory was at the age of 3 when I was with my parents at on holiday, and just found it impossible to join in with the other children, and that has really stuck in my mind, and I can feel the sensations even to this day. That I've got an exact photographic memory of what happened. And that has kind of shaped my life. I don't know why that happened then, but I've held a belief that, talking to people is, I don't know, unsafe or or I've developed a hypervigilant response. I don't know. I've thought about that a lot, and the way you describe that, it makes more sense to me.
And then the tricky thing, and one of the most daunting challenges in working with social anxiety, is we have this visceral response that you and other sufferers have, this mind-body, non-intellectual discomfort.
Yeah.
And what is important, and this is probably the hardest thing in treatment, is to nurture. And by the way, nurturing is another mind state. There are 5 mind states, and all with specific energy. And that's an important tool that we use in treatment. But to nurture a positive interpretation regarding the visceral response, you go into a challenge situation, public speaking, socializing in general, a date, a sales call, whatever, and you're going to have adrenaline. That's what drives the visceral response. And what I do is I teach the patient to put a positive spin on it, meaning the adrenaline is going to be there, so don't hope that it's not. That's going to be a waste of time. So you've got to surf the wave metaphorically with the interpretation that the adrenaline is your friend and source of power. In order to really implement that, a certain amount of historical work has to be done to teach the person how they learned the negative association to adrenaline.
Yeah, that's interesting. I've been thinking about that recently. Like in a public speaking group I run, there's even the word public speaking to some people, you have like a response of adrenaline, like a real gut feeling, and people avoid that like anything. It's so painful. And did you want to go into briefly how your 5 mind states work in a bit?
Actually, I think that would be a little too technical right now. There's a couple I really appreciate this interview we're doing, a couple of other issues I'd like to cover here. One of the questions that the 5 mind states, by the way, in the book Work Makes Me Nervous, which came out a couple of years ago, about performance anxiety at work, my co-writer Amy Lemley comes out of the closet, so to speak, with her avoidant personality. There's not a lot of literature out there on that. And one of the important words that she uses, this is such an important word, is integrity. Many people in the psychiatric profession believe that an avoidant personality is not resolvable. It is when you have leverage. Leverage is a tough thing. So she coins the term integrity as it applies to that. So I recommend that book. But here, I want to tell you something very, very important. There was and I'm sure a lot of your viewers can relate to this. 2 years ago, a college student, Brandon Thomas, 20 years old, committed suicide because of his fear of blushing, erythrophobia. And shortly thereafter, CNBC and other news outlets were carrying this, and they quoted a quote, the world's expert in blushing, a psychiatrist from Chile, who said that blushing is an uncontrollable response. Now, this is an example of the problem with not only the therapy community, but the medical profession. This kind of thinking enables the problem in general. It's a very hard thing to control, but it's not an uncontrollable reaction. As a matter of fact, later this week, I'm doing an interview with 4 blushers, 2 who've cured the problem, and I don't use the term loosely, 1 who's in the middle, and 1 who's just starting therapy and who is pretty stuck. And when people listen to this interview, they will learn that it's not an uncontrollable reaction. It takes a lot of work to be able to control it. Okay, this is gonna, if people want to go to my website, socialanxiety.com, that interview will be available in a couple of weeks, as also with a self-help program. And one more, I know we're limited for time, so I want to get this in. There is a foundation called the Andrew Kukis Foundation, and this is an example of a young man, another tragedy, who had a 4.0 average in college, committed suicide. This was 3-4 years ago. And his family started a foundation, and they hired me to create a documentary training program for mental health professionals where they can get continuing ed credits. It's called Social Anxiety, The Untold Story. And I brought patients from around the country. and we cover everything from the personality types to the mind states. And it's, there's a lot of, one of the things that, there's a term that's used a lot, which I, have a problem with, and it's in research and clinical circles. It's called evidence-based work. What is evidence-based work? So often, evidence-based is people create statistics that they put on paper. But in this DVD, which is 11 hours, there are 15 to 20 real patients who suffer from everything from public speaking to blushing to selective mutism, the children and adults themselves, to detachment, which, by the way, is another thing that all sufferers have in common as a defense mechanism. And as a community service, while people can get this for continuing ed credits at CMI Education Online, or PESI, P-E-S-I, they can get it as a community service if they also go to socialanxiety.com. It is the state, I don't mean to push too hard here, but it is the state-of-the-art in science self-help program with the most actual documented in-person evidence of success.
Fantastic. That's really good work. So I was just going to ask you, you spoke about selective mutism earlier on. It would be really good if you touched on that, because am I right saying it usually it's more common in childhood, is it, or do you have adult cases as well?
Selective mutism, this is mind-blowing. Selective mutism impacts approximately 7 out of 1,000 children, which is the same statistic as autism. Thank God there are many programs in place for autism. There are hardly any for selective mutism. Selective mutism is often misdiagnosed as a speech disorder or autism. It is very specifically a variation of obsessive compulsive disorder and a manifestation of social anxiety. Now, it impacts many children. The obsessiveness refers to the conscious and non-conscious thinking, worry that the child experiences. The compulsion is the verbal shutdown. I can assure you, the children turn into adolescents and into adults. In the DVD that I was just talking about, we have interviews with adolescents and adults who have experienced this. Now, when you take typically a 4, 5, 6-year-old kid like this to individual therapy, 99% of the time it is going to be a waste of time, energy, and money, because the kid is going to sit there and in most cases not be verbal. So then the therapist, the well-meaning therapist, gets sucked into enabling scenarios like, let's do art therapy or whatever, not to knock that, but that becomes enabling. So what I've done, and this goes back to what I said at the top of the interview with enabling and the role of parents, I teach the parents how to be therapists. Because they have the leverage. And as they learn how not to enable, they learn how to process with the children, which is the process of helping the child identify thoughts and feelings. It's no easy gig, but it's very profoundly productive when they learn how to do it. And there is a silver lining here. I mean, the biggest mistake with social anxiety in China is leave the kid alone, they'll grow out of the problem. Right? Well, I can assure you nothing is further from the truth. The silver lining here is when you get the kid in at age 4, 5, and 6, and the parents are willing to do the work, you can arrest or control that anxiety before it becomes more a part of the personality. But I love working with kids with social anxiety when I have cooperative, realistic parents. The problem is you've got to get past the stigma of parents saying, I don't want my child to think there's anything wrong with them where they can't, fit into society. They'll grow out of the problem. It's no big deal. This is the kind of content that makes social anxiety the quintessential disease of resistance. And when I started with social anxiety, working clinically in 76, 77, there were not a lot of people who worked with it, and the term was not that widely used, and now it's everywhere. And what I find is that in most cases, the process or the people who are out there on the internet or whatever are looking at it in such a superficial manner. Social anxiety it's a psychophysiological reaction. And it's not just, everybody says, what technique do you use? Well, technique is important, and the primary technique is learning to control that adrenaline-driven visceral response. But if you really want to resolve it, you've got to get to the core issues of embarrassment, shame, humiliation, and that anger at deep levels, which is recycling.
Yeah, thank you for that. That's fantastic. So, have you made any developments recently that you wanted to share? Is there any, over the past year or so, have you made any improvements or discoveries on your work?
The number one discovery that I'm making all the time, each patient, each session, it's just amazing, is the profound dynamic of the repressed anger and rage. And I have to credit Dr. John Sarno, who's world famous for his work on back pain. And he's written a number of books on the subject. His intervention with back pain is the same as mine with social anxiety and depression. To help the people understand this anger is so important. Okay, so that's been so important in the last decade. The DVD, Social Anxiety, The Untold Story, is probably my best piece of work, and that was released a year and a half ago. And this work that is coming out soon, the interview that I'm doing later this week, and the self-help program for blushing, which is coming out in a couple of months, I'm so pleased about, because so many people are so confused with this. I mean, at the website, socialanxiety.com, there are numerous interviews with people who are considering going for an operation to sever their nerves, a sympathectomy. I mean, this is very desperate stuff. So to be able to help these people in a natural way is very gratifying. But, I like to be very transparent from the beginning. And everybody has their own learning curve. And with hard work, there's a lot of success that's possible.
Yeah. And that's the kind of thing I didn't realize, when things were bad for me. I expected someone to take away the problem, and I realized that from my experience, there was some kind of hard work and exposure to the things that I found difficult. So what kind of success rate do you get with your patients?
Well, first of all, it's hard to be doing this without success for 35 years, let me tell you. Because if you don't have success, you burn out. And the reality is that, again, I've seen everything from a total cure to the problem being permanent and everything in between. So the answer to your question is, it depends on how hard a person is willing to work. Okay, a lot of times people come into treatment and they have unrealistic expectations. A person has had social anxiety for 25 years. They have a lot of obsessive worry, anxiety in the challenge situation, and underlying depression. I want to get better in 5 sessions. Well, what I do at the beginning, that's not possible, by the way. Okay, but everybody has their own learning curve. And what I do at the beginning of treatment is to reality test people. But in terms of the overall success, between the free library of clinical interviews at the website, socialanxiety.com, and the DVD, Social Anxiety, The Untold Story, I feel pretty confident saying that I don't believe that any other therapist, organization, hospital, university, or whatever could come up with more actual people. I'm not talking about written stats, but people who come forward. And it takes a lot of courage, as I'm sure you know, for a social anxiety sufferer to come on board and expose themselves, either in an audio or a video interview. So I feel pretty confident with it.
That's really fantastic. So just to finish the interview off, what piece of advice would you give someone watching this who wants to get help with social anxiety? Because it can be so overwhelming, can't it? Some people go to their GP, their doctor, and you know, they're given medication or whatever, but you know, there's all sorts of different therapies you can try, and for me it was quite confusing. So what one step would you get people to take first of all?
Well, first of all, there's a right and a wrong way to use medicine. That's the subject of a whole nother interview. Okay, but by the way, I have a lot of this. There's 2 hours of information with very skilled psychiatrists in that DVD to really help the listener. Okay, but this is what the number one, 2 pieces of advice, and I'll do this in the form of a question. So I'll put you on the spot. Do you know what your most valuable asset is?
Do I know what most valuable asset is?
I'm causing you some adrenaline, maybe. Okay. Your most valuable asset is it's not your bank account, it's not your home, it's not your mortgage, it's not even your career. Your most valuable asset is time. Time is not elastic, it does not stretch. And people with social anxiety are the world's best experts at rationalizing as to why to avoid. I'll speak in front of that group next year. I'll wait to date, when my acne goes away, whatever it is, okay? And you've got to make time your friend, because the more that time goes on and you don't take action to solve the problem, the more it accrues. It's like buying a stock will go down. It doesn't get better with time, it gets worse with time. That's point number 1. Point number 2 is whether you're doing self-help or treatment, there are 4 domains that need to be considered. One of the biggest cliches in the universe as it applies to social anxiety is the reference to cognitive behavioral therapy. Cognition obviously is important. Everything starts with a thought. Behavior speaks for itself. But if you do not integrate emotion and physiology into the spectrum, productivity is going to reach the point of diminishing returns. And the most important thing to heal is to do work on the emotions. And that's what most people who suffer don't want to do. Because it takes work. And you've got to feel, you're going to have to negotiate the discomfort. And so many sufferers say, is it worth it? What if? Is it worth it? Well, you only get one life.
Yeah. And you've probably found this a lot yourself, that people who, if you're stuck in quite a helpless state and you're asking that question, is it worth it to go out and face my fears or whatever? I found that I got so pissed off, excuse my language, with the way things were going. I had no choice but to go out and face them. Do you get a lot of people like that who are just so fed up with being stuck that there's only one direction now?
The fed up, it's interesting. There are 3 basic things I work with if I divided my practice into thirds. One is performance-based public speaking. So the executive says, hey, my career's on the line and I've been screwing around avoiding this for X amount of time, but now I got to do something or I'm going to get fired. So they come, okay? Number 2 is the selective mutism thing, where the parents wake up. Well, actually, it's only like 1/100th of 1% of parents are really doing something about this. But finally, the parents are getting the message, my kid's not talking in school for a bunch of years. Oh, he or she's normal at home. Okay, a lot of confusion and denial. So they've got to fix the kid, so they take action. And number 3 is the pervasive social anxiety kind of thing, where either, as you said, the adult will get fed up and has initiative, or the parent will take action because the 26-year-old is playing 100 hours of video games and not functioning.
Yeah.
But most people who have social anxiety do not take action, sadly. That's why, hopefully some people will, see this interview and will get a little motivated. You're doing good work.
Thank you so much, and you. I really appreciate your time today, and let's hope that anyone watching this can go and get help. And there is a way out of it. It's not the way I see it. It's not part of who you are, and you can, in a way, you've learnt to be this way, and you can and learn it with the right support. So yeah, thank you so much, Jonathan. Appreciate your time.
Thank you for having me.
Thank you.